So some of the great benefits, things I love about Stress First Aid is that it really encourages a team and peer support. It's not this is the end all to fix all. It's not we're going to take all the stress away from you. This is life, and here are some tools that you can utilize to really empower you as an individual, both in your profession as well as in your personal life.
Some of the benefits of Stress First Aid is creating that moment of pause for our nurses to communicate with each other about what they're experiencing. It opens that dialogue for a nurse to say, hey, I need to take a second because I'm in a situation that I don't like and it's really uncomfortable. And for me to be successful in caring for my patients, I need to step away. I need to talk to someone about what's going on.
Once we start that culture of it's okay to express yourself in the sense that I am not doing okay, it's gonna get better. And it starts with just having those open lines of communication and dialogue and giving the skills to do that. And that's what Stress First Aid does.
So really we were looking for a program that really would help our nurses promote wellness. I think everybody knows nursing was struggling just a little bit even before the pandemic, but since the pandemic, I think it's been really hard for nurses to kind of recover and create those kind of work environments that are comforting and that make you want to stay. And when we heard about Stress First Aid with the American Nurses Foundation, we were really interested. And what Josephine and her team have done on 10 Ardmore is really try to incorporate some of those concepts and really build it from the ground up as something the staff are interested in and speaks to them.
Yeah, and we haven't realized that we've been doing Stress First Aid for a long time now without us realizing it. But we just kind of incorporated what we learned from the training and put it into action in our unit.
We've now formed that teamwork mentality. The communication is incredible. I feel Stress First Aid has served a platform for people, especially the ones who don't like to discuss mental health. It gives them that open vicinity to talk about it and feel like I'm not the only one.
I would totally recommend that everyone implemented Stress First Aid. And the reason why I say that is because adjusting the culture of nursing is something that is absolutely necessary for us to survive as a profession. It's necessary for us to adjust and approach that change from a grace standpoint. We've had that grace for our patients, we've had that grace for their families, but to allow that grace for ourselves would be world-changing. And it's not something that you can implement at one hospital. It's something that when a nurse goes and floats to another hospital or they move and go to a different state, they still need that support.
I think what's great about the program is it does have a lot of simplicity and a lot of things that really speak to nurses, but it really helps us focus on those behaviors that we can replicate and that we can really hardwire for our teams.
It's teamwork that help us get, through the day. Even though it's hard, it's really hard. Med search is really hard, but we get through the day with just helping one another, covering for one another. Like, hey, you need help. I can see you're struggling.
I would say if you're struggling with your mental health, Stress First Aid is exactly what you need, because that support through that is really can be life changing.
I've shared this with the creator, Richard Westfall and Patricia Watson, that this framework, yes, it is absolutely essential for healthcare workers, but I feel like on a human level, anyone can connect with this framework of managing our stressors in our lives because we live in a very complex global world.
We've developed this program with support from the United Health Foundation, a leading philanthropist focused on healthcare, focused on healthier communities, and a diverse and dynamic workforce. And they came to us saying, we want to help what nurses are going through today. And together we've developed this program's ability to impact nurses' lives. And when you impact a nurse's life, you impact their family and their patients and their communities.